So thank you so much, everyone, for tuning in. Um, as Shanna said, my name is Stephanie Ramierez. I am a speech language pathologist working primarily in outpatient therapy with North Kansas City Hospital. I also recently just got certification as a certified dementia care specialist, so I'm pretty excited about that as well. This topic is very near and dear to my heart. Both of my dad's parents passed away from Alzheimer's in 2019, actually within 6 months of one another. So I have definitely seen what this disease, what the effects are from start to finish. And I just really feel passionate about sharing my experience both as a professional and just as a person who's been affected by the disease. I often hear the term when someone is reaching the end of their journey with Alzheimer's that they're an empty shell of a person. And although I feel that's a negative analogy, I do like to use the analogy of a shell because I think that, yes, the shell may become more difficult to open as time goes on. There is still something beautiful inside, and the person who was there is always there. And understanding how to open that shell is going to be the key to really meaningfully connect to that person and improve, both their quality of life and yours. There's an art to it, just like you see the oyster shuckers in New England who have practiced and trained to do that. You can practice communication strategies for people with dementia to help just open that shell and create that connection. So hopefully tonight you will get some good ideas for how to do that. I also want to start out just with the thought, and especially with dementia, we often hear that they have behaviors. And instead of seeing those behaviors as something negative, what I'd like you to try to think about is that all behavior is a form of communication as well. So even if the person is no longer verbal, they are still communicating with us in very meaningful ways if you can understand what they're trying to tell you. So hopefully also we can go through that and give you some insight on maybe what some of those more difficult behaviors associated with Alzheimer's and dementia maybe are trying to communicate. So, oops. So for tonight, what I'd like to start out with is just a little overview of what really is Alzheimer's and dementia. I have organized the talk according to the stages of the disease and then your role as a caregiver at each stage. And then also communication tips, therapy, and then finally, as Shanna said, we will end with some questions and review if there's anything else that you would like to discuss. So, Alzheimer's and dementia are often used interchangeably, however, they are different. So, dementia is the umbrella term, it's the general term for loss of memory, language, problem solving, and other thinking abilities that are severe enough to interfere with daily life. Alzheimer's disease is one type of dementia, and it is the most common type of dementia, accounting for about 50 to 75% of dementia cases. So Alzheimer's disease is a type of dementia, which is the umbrella term. And here I've just got some graphics here. So on the left, you'll see different kinds of dementia. So Alzheimer's all the way on the left, 50 to 75%, but then you also have vascular dementia, dementia with Lewy bodies, and frontotemporal dementia. And a lot of times it is helpful to understand what kind of dementia you're dealing with, because I think that helps you kind of have a roadmap of what to expect as far as behaviors and progression and those types of things. It used to be that Alzheimer's was only diagnosed via autopsy after a person had passed away, but now doctors are really being proactive about diagnosing it much sooner. And ultimately, I think that leads to much better outcomes. Once you know what you are facing, it allows you to make decisions about care, and we're going to go into that a little bit as well. But I think that's a very positive thing. And then on the right, I've got a graphic of all of the different things that can be altered by dementia. So things like memory, perception, reasoning, attention, thinking, judgment, language. And I think this is helpful to really think about some of those behaviors that we see and maybe what they're trying to communicate by those behaviors. Because a lot of times, if some of these things and ways of thinking are not there any longer, they're going to have to find another way to communicate with you. So worldwide, I would say over 50 million people at this point have dementia. An estimated 5.8 million Americans aged 65 and older are living with Alzheimer's dementia as of 2020. And Alzheimer's is the 6th leading cause of death in the United States. It takes a toll, not only emotionally, physically, but financially as well. So the lifetime care cost for one person with Alzheimer's is estimated to be about $350,000. And in 2019, the United States paid out more than $195 billion in Medicare, Medicaid related to dementia-related care. By 2050, over 13.8 million people are projected to have the disease. So this is something that's not going away. I think research has come a long way in, looking at different medications that can help alleviate some of the symptoms of the disease, but as of yet, we do not have a cure. So as we move into the stages of Alzheimer's disease, I just want to make sure that I point out everyone is different. No two people experience the disease the same way. And so while I have some tips and tricks, not everything is going to work for everyone. So a lot of times you really have to try different things. And maybe even something that you try one day doesn't work the next day. So it's good to have a lot of tools in the toolkit because everyone is different and every day is different for everyone. My grandfather actually had the disease for over probably 5 to 6 years, and it was a very slow progression, while my grandmother was diagnosed less than 6 months before her passing. So her progression was quite fast. So even within families, it can look very different. As I mentioned, my grandfather lived about 5 years. On average, a person with Alzheimer's lives 4 to 8 years after the diagnosis, but people can live as long as 20 years depending on other factors and health conditions. No two people experienced the disease the same way. People may progress through the stages at different rates, and some people might stay in a particular stage for months or even years. But understanding what the stages are and what's happening in the brain, again, can also help us think about how we can communicate with people. So as the disease progresses, the neurons in the brain, which transmit information from one part of the brain to the other with electrical or chemical signals, become disrupted. So with Alzheimer's, you might hear the term plaques and tangles, and we're going to see what those look like here in just a minute. But Alzheimer's does disrupt that communication and causes ultimately the brain cells to die. And the regions of the brain begin to shrink or might have atrophy. You might hear that term as well. So on this slide, I've got a healthy brain on the left, and then an Alzheimer's brain on the right. So you can see that on the right, It is quite a bit smaller. There's more gaps in between the spaces of the brain. And then those neurons, the purple, they almost look like trees, have some of those plaques around them, which are disrupting those signals. And here's just a close-up of what those plaques and tangles look like. And they're doing a lot of research on this and trying to see if maybe we can even identify those in the brain far before someone starts to show symptoms. So I think that would be really exciting if we could potentially do that. So that's what's going on inside the brain. What do we see on the outside? So Alzheimer's is typically divided into 3 stages. So the early stage, or you might hear mild, middle or moderate, and late or severe. So again, understanding what stage you're currently in helps you, I think, plan and prepare for the future and what to expect down the road. So in the early stages of Alzheimer's, most people function independently. A lot of people still drive, take part in social activities, volunteer, and even work. People may have difficulty with more complex tasks, such as managing a daily schedule, organizing medications, or household finances. So you might start to notice some errors in those more complex activities where maybe they wouldn't have made those errors before. In the early stage, a care partner's role is really to provide support and companionship. I think that with an early diagnosis, the care partner and the person with dementia have the opportunity to make decisions about the future together, including things like legal, financial, and long-term care planning, which is very important. I think nobody wants to have those conversations because, you know, let's face it, they're not fun to have. But holy cow, can it save a lot of heartache down the road if you sit down and you have those conversations and everyone is clear on the plan. The person living with dementia can take advantage of available treatments. They can participate in clinical trials. You can establish a connection with local resources and support services, and just taking advantage of those, you know, can help reduce the anxiety in both parties and really help for better outcomes. I think especially in the early stage, the primary goal is safety. So making sure that the person living with dementia is safe in whatever environment they are in. So maybe they can be at home, but maybe they shouldn't be cooking, so we unplug the stove. Or maybe they can no longer manage their medications, so the daughter comes in to help do that once a week, and an alarm is set to remind them every day to take the medications. So again, primary goal is safety. I think as much as possible, minimizing stress and thinking about, you know, living in the present moment, finding activities that you enjoy, that they enjoy, that things that you can do together. That's really helpful. And again, I think that it keeps them active. That's a very important thing. I, you know, talk about my personal story a lot because I think it's just some, you know, real life examples. But my grandfather was going out on the farm, checking on the crops and seeing what they were doing, you know, with the land and the tractors and all of that, you know, up until probably a year before he passed. And I think the fact that he did do so well for so long was because he was so active. He was also a part of the VFW, and, you know, he did bingo every week. And so finding those activities, because I think with the diagnosis as well, you really see the person a lot of times pull back and not be involved in things as much. But being active and staying involved is important. So in the early stage, some communication tips. I think that identifying a cue or phrase that you can use to confirm if the person is comfortable receiving support. A lot of times I hear people getting very frustrated because families jumping in to help them when they can't think of a word, or, doing everything for them, so then they feel useless. So really having that, communication and boundaries. So you might say something like, is there anything I can do to help? Or a nod or a signal that it's okay to chime in if they're having difficulty remembering a name or a word. Reducing distractions during conversations, I think, is very helpful, talking about one thing at a time. We talked about attention as being one of those things that's affected by dementia. So someone with dementia might not be able to engage in kind of the mental juggling that's involved with conversations that have multiple threads. And I think that always writing things down is helpful. So we always kept a notebook on the counter with reminders if anybody stopped by, when the next doctor's appointment was going to be. So it was all there, black and white. You could refer back to it. They could refer back to it. And then, when having those conversations, I think making sure that you don't really make the person feel like they're being put on the spot. So instead of, specific facts, asking questions that are more open-ended, general knowledge questions about the world. So, tell me what it was like. My grandparents grew up in Minnesota. So tell me what it was like when, you guys used to go sledding as kids, versus now what year did so-and-so, have that sledding accident? So it's much less confrontational. Also providing choices. So instead of, what do you want for dinner? Or what do you want to watch on TV? You can say, it's Wednesday. Do you want to watch Dancing with the Stars or the news? Do you want to have meatloaf or pasta for dinner? So it's much less overwhelming for the person if you provide a choice versus just having it be open-ended. Moving on to the middle stage of Alzheimer's. So during the middle stage, damage to the brain can make it difficult to express thoughts and perform routine tasks. You might notice the person jumbling words more, having trouble dressing, getting frustrated or angry, or acting in unexpected ways, such as refusing to bathe. So again, I think we're starting to see some of those, quote, negative behaviors. But what really is that trying to communicate? So as a care partner, I would say in the middle stage, people, typically take a much more active role. It's important to have lots of flexibility, lots of patience, and understand that there will be good days and bad days. First and foremost, I think having a, daily routine, very structured, so that they know what to expect, is very helpful. So, they are able to kind of refer back to those long-term memories as opposed to the short-term, which is typically much less reliable. You might think about, different behaviors. So for example, maybe, when somebody, an aide goes into the house and tries to give mom a shower in the morning, and she's, getting kind of disgruntled about that. Think about what she's trying to say. Has she always taken a shower? Or maybe she prefers a bath. Maybe she doesn't like to get up that early. Maybe she's kind of embarrassed about being seen without her clothes on. So trying to kind of put yourself in their shoes and know that in their mind, what they're doing makes sense. And I think also meeting them where they are. So maybe, at the nursing home, Jim goes to the door every day at 7 o'clock in the morning and tries to leave because he thinks he's late for a job that he had the last 65 years. So instead of saying, Jim, you're in a nursing home right now, we really need to go back to bed, or it's time for breakfast, you don't work anymore. meeting him where he's at and just saying something like, hey, Jim, you're going to need a good breakfast to be able to have the energy to go and do that work. So why don't we have that before you leave? And typically by the time, they're settled and done with whatever activity, they've forgotten what they were trying to leave in the first place for. So again, just trying to put yourself in their shoes, meeting them where they're at, making things very routine and creating a lot of structure can be very helpful. I think it's important, especially in this level, to research all of your options for care. They might need the next level of care if you feel like that safety factor is an issue. So I think, again, already having the research done and kind of having a plan in mind is really important. But if it hasn't already been done, it needs to be done here in this middle stage. And then knowing the resources. So I am a community educator as well with the Alzheimer's Association. That is a phenomenal organization that provides so many free services and supports. So you can go to their website, alz.org, and this might be something good to write down so that you have it available in the future. They have a 24/7 helpline, and they are available to answer any questions, provide support. So just having that number on hand, which is 800-272-3900, is a very great thing to have. And a lot of people, I just tell them, put it in your phone right now as you're watching this, because you never know when you're going to need it. And I just wanted to show you a screenshot of the Alzheimer's Association website. So you can see that green arrow has a lot of good information. So let's say you just got the diagnosis and you really don't know what to do. That's a great place to kind of check out and get some good support. The orange arrow has the local resources. So of course, unfortunately, living in this COVID time, all of the in-person education and support groups are not meeting, but they are doing tons of online education support groups. So definitely take advantage of that. And that's actually really convenient because then you can do it from home, kind of like we are right now. So, and then over in the right-hand corner there, again, is that 24/7 helpline. So definitely, if you or someone has gotten the diagnosis, this is wonderful stuff. And I will say everyone over at the Alzheimer's Association is so nice and just very willing and able to help with whatever questions you might have. So in the middle stage, when we're thinking about communication, I think it's important to use simple language, and here's another caveat, not babyish language. So I think that your language should be respectful. This is a person who's lived a long and full life, and they are an adult, and they should be talked to like an adult. You can use simple language without talking down to the person. So 1 to 2 directions at a time, offering choices like we talked about, yes or no questions as opposed to open-ended. So do you want to put on your sweater? That's a yes or no. Talking slowly, allowing plenty of time for them to respond, and repeating information as needed. When I'm talking about, kind of that simple language, repetition is also very helpful. Avoiding overcorrecting or putting down. Ultimately, when your loved one or you recall something incorrectly, is it really that important? Is it really, important that we correct someone or make them feel, like they've made a mistake? I think instead, trying to redirect the person to something that's more important. So instead of saying, come on, you know my name, and then they're like put on the spot, you can say, hey, it's Stephanie, your daughter. I'm here to see you. offering that information so that they don't feel put on the spot. Avoiding pronouns, so referring to people by their names. So instead of saying he, she, they during conversation, you might say, you know, like, hi, Grandma, it's me, Jeff, instead of, hey, it's me. So really making it specific. You know, listening also to what they're telling you. You might really be surprised at, you know, some of the things that they have to say. And if you don't understand what they're trying to say, politely let them know and maybe ask them to repeat it. Um, and then finally, I think it's so important. You got to keep a sense of humor. If you can laugh together and share jokes, as long as it's not at anyone's expense, I think it is so good for the heart to laugh and just have a good time. So really try to keep that sense of humor because it can be very valuable. Okay, so moving on to the late stage of dementia. So by this point, the person typically needs full-time care, either at home or in a nursing facility. They might need assistance with walking. They might need assistance with toileting. They might be unable to walk. A lot of times these people have difficulty eating and swallowing. And they're very vulnerable to infections, especially pneumonia. As a speech pathologist, I like to tell people I work everything from the neck up. So I work with memory and language and speaking, but I also work with swallowing as well. And so a lot of times a swallow evaluation is indicated just to make sure that what they're drinking or eating is not going in their lungs and, you know, causing them to get sick. And then in the late stage as well, a lot of people lose the ability to talk or express their needs verbally. But again, I think that you really have to pay close attention to those behaviors because that can really communicate a lot. So in the late stage of Alzheimer's and dementia, the care partner's role is really to, you know, preserve dignity, quality of life, helping make those decisions about care, hopefully with the knowledge of what that person would have wanted. As I said, swallowing is typically an issue, so really monitoring the eating, allowing plenty of time to eat, adapting the food as needed, keeping track of weight, encouraging fluids. A lot of times a person with dementia won't remember to take a drink. So offer every time you come in the room, just say, hey, let's take a drink. Or, you know, do you want to have some water with me? And, you know, you can help keep them hydrated. I will say, obviously, if people are not up and moving around, their appetite is going to change. That is normal. And it's also a normal part of the disease process to not eat as much. So I think that just, you know, making sure they're comfortable and making sure that, you know, you are just monitoring their overall health, pain levels. You know, we talk about behavior. So some of the things that you can look for, you know, if a person is grimacing or maybe they're holding a specific part of their body really tightly, or maybe they're rubbing, you know, their knees or their hands together. You know, those are all behaviors that communicate that they're probably in pain. Maybe they're fidgeting around or, you know, picking at their hands. You know, that might indicate that they're bored. So we need to give them something to do. So really focusing in on what their behavior is telling you and communicating with you can help you provide the best care that you possibly can. And being aware of what is normal behavior for this person, because if you know, that behavior changes, it could be a sign that they have some kind of an infection or an illness that needs to be addressed, that they need to get to the doctor for that. So maybe, you know, they are more sleepy than they normally are. Maybe they're more agitated than they normally are. And, I think that would really be concerning, and you'd want to look closely at whether they're not, they're hungry or they're thirsty or they're in pain or they have to go to the bathroom. And if not, then maybe there is some kind of an infection going on and you need to get to the doctor. So with the later stages of Alzheimer's, I think the communication tips are really just as important as if you were having a verbal conversation with someone. You want to use a positive, caring, respectful tone. Again, refrain from baby talk. I think that's one of my biggest pet peeves, or any other kind of condescension. I said condensation. We've had a lot of rain here. Um, but in any case, I think that, again, these are adults. They should be spoken to as an adult. And if they are nonverbal, try using more nonverbal cues, approaching slowly from the side. If someone just like barrels ahead and has their face in your face, it's like, whoa, that would make anyone really want to pull back. So maintain eye contact, smile, greet them at the door. Even if they're, not going to respond to you, they hear your voice and they can, perceive a lot from your tone of voice. And then when you're trying to engage with that person, really think about your 5 senses. So touch, sound, sight, taste, smell. You might give them a nice hand rub with some scented lotion. You might listen to an old song that they really enjoyed. You might go outside and watch the birds now that the weather's getting nicer. That would be lovely. You might bring them a slice of their favorite pie. You might have their perfume, or something that smells nice that might evoke some memories, like coffee. A lot of times the smell of coffee will bring people back, or pine, kind of those Christmassy smells. And then again, reminiscing, I think, together, even if they are not getting all the facts right, they're still communicating and sharing some really awesome stories. So just really thinking about, again, if you can engage the senses other than speaking, you can communicate, and I think communicate really well with this population and this stage. So again, when we think about kind of those negative behaviors, I wanted to highlight some of these because a lot of times that's what people struggle with the communication. And I think that, again, focusing on what is causing these things to happen. So when we see somebody who's angry or aggressive, maybe they're hitting or biting or lashing out. If we can identify the cause, again, pain is a huge trigger for aggressive behavior. I think figuring out what may have caused it, and then focusing on their feelings, not the facts. So try not to dwell on specific details, but consider their emotions. Don't get upset yourself, because that's just really going to make everything, kind of spiral. So if you do need to take a moment, step away, and they're safe for you to do that, I think definitely, stepping away and then taking a breath, coming back, and then seeing if, shifting their focus to another activity can help get whatever's bothering them off their mind. So, trying something different, trying a relaxing activity like music, or like I said, a hand massage, or even exercise. Let's go take a walk. I feel like, a lot of times just going outside can be so helpful. And thankfully, I hope we're through with most of the bad weather that we can do that now. And again, ultimately, ensure that you and the person with dementia is safe. So if they are not able to calm down, you need to get help. Always call 911 if it's an emergency situation. And if you do call 911, make sure that the person who's responding knows that this person has dementia. And again, you can go online to the alz.org to connect with other people who are maybe experiencing some more of these behaviors. I think sharing different strategies is always helpful. My grandmother at the very end had a catheter and it was just bothering her so much. And I know that it is uncomfortable. So, we definitely worked to try to make her comfortable with pain medication. But a lot of times that wasn't going to help everything. So I would try, I oftentimes would rub her hands with lotion, and that really seemed to do the trick, because she just really liked that a lot. And we would talk about, her brothers and just try to laugh and get her mind off of it, and it kept her from pulling at it. So that's something that maybe I would share with someone who was going through this, and then, they could give it a try. I think we can learn a lot from each other. So hopefully you can get that support. Anxiety and agitation is another common, communication behavior that we see with this population. So I think it's important, listen and provide reassurance. How would you feel if you woke up and you had no idea where you were? You had no idea what year it was. You didn't know where your family was, or you thought you were going to get fired from your job, or you thought that, oh my gosh, that your baby was not being watched. So, definitely take the time to listen to their concerns, provide a reassurance, and respond in a very calm and supportive manner. You might modify the environment. So you might have signs that kind of can orient the person. We got a really large clock that had like huge numbers, and then it would have the day of the week, the weather, all of that on there. So my grandfather could see that. And, you might distract the person if it really is something that they, like I said, with the catheter, she was kind of agitated. So we try to distract her from that as much as possible. And then, you can be honest. I know I said try not to overcorrect, but, if the person's maybe having some hallucinations and they're like, somebody's in the house, did you see him? Instead of saying like, nobody's here, or yeah, I saw him, you might answer with something like, I know you saw something, but I didn't see anybody. It's okay. And, that way you're not denying what they see or, are saying, but you're also not starting an argument. So try to, maybe be honest in those situations that divert if you can. So I've talked a lot about what you can do as a communication partner. I wanted to spend just a little bit of time here talking as well about therapy that is available. And as a speech pathologist, I do work with patients that are at all stages of the disease process. So, focusing in the beginning on, safety awareness and strategy training and exercise and staying active, to at the end, mostly working with family on, ideas for how to connect with them. And I always encourage family to attend because I think, it really is, really helpful if the support person can be there. Speech therapy includes things like cognitive stimulation, strategies, like I said, that are just designed to help maintain independence as long as possible, and that safety, again, as long as possible. Planning, we also can monitor that swallow function, like I said earlier, that's very important. It is covered by most insurances with a doctor's order. And a lot of times I, like to tell people that even if they're just in the beginning, they haven't gotten a diagnosis yet, but they just feel like something's not right, or, they maybe had a family member that passed away with the disease, and now they're starting to, wonder if they're showing signs. Coming in, getting an evaluation can be a good way to have a baseline as well. So this is what I could do in 2021. Now, fast forward to 2025, where are we at? And I think it can be good to help compare. And then, as part of therapy, we talk about pillars of brain health and just overall strategies to keep your brain healthy. And really, we set people up with an exercise program that they can continue just as part of a healthy brain lifestyle, even when they're not coming for therapy anymore. So it's really beneficial. I think, a lot of times people feel like there's nothing that can be done, but there is. And I think people have really good outcomes and just feel a lot more supported and know that they're not alone. So I've highlighted a few things that we do. So we've got some Montessori type activities. You might have heard Montessori method used with kids, but there's actually a large body of research in using the Montessori method with adults. And basically it comes right down to just very functional items that you can incorporate into therapy. And going back to, people feeling kind of useless or pulling back. So, hey, I really need your help folding these towels. Could you help me with that? And, they have a task to do and they feel like they're being useful. That's just one example, but there's a lot of them. Reminiscent therapy. So, you can put together a picture book of old photographs with like labels of names and where they were taken. And you can just walk down memory lane, which is great. Swallowing assessment, again, just making sure that everything's going down the right way and we're getting good nutrition. There's lots of apps and computer programs out there. Some of them are free, some of them cost money. Ultimately, you just have to kind of judge the person. So some people are very tech savvy or they enjoy being on the computer, and some people really hate it. So I wouldn't put an iPad in someone's hand if they were really not comfortable with it. But if they enjoy it, it can be great. Staying up on current events, checking the weather. My grandma used to watch as she would get on the airline's website and track our airplane if we were traveling somewhere. So anyway, it can be a useful tool. I tell people too, we talk a lot about it in therapy as maybe like timers, alarms, reminders, those types of things. Again, only if the person is really tech savvy, but if they are, it can be a good tool. Safety training exercises. So we do lots of mock medication management, mock bill paying, making sure that's all good and not, no errors there. And then external memory aids. So things like, communication books, calendars, alarms, things outside in the environment that are going to just help kind of cue that person into their current environment or like their current, safety precautions. So, you might make sure that you have like a sign on the door of the closet where you don't want them going because you keep all of the like heavy duty chemicals in there for cleaning. So you might have a stop sign on the door. So just some things that are in the environment to help keep that person safe. And as I said, we do a lot of caregiver education and support because ultimately it's not just about the person, it's with dementia, it's the team, the whole, gamut of people that are involved in the care. And we can also, refer out to other specialties as needed. So say the person's been falling a lot and has difficulty with balance, they might see a physical therapist for some strength training, or maybe they are, feeling really depressed and they need to see a counselor. We can make those referrals and make sure that they get the help that they need. I had mentioned the stimulation activities. So those are just, exercises that we can do to, keep the brain active and keep it from getting stagnant. And then those pillars of brain health, so that overall we know the person is leading a healthy lifestyle to, really help prevent further decline or slow the progression as much as possible. So that's kind of my role as a speech pathologist. But again, I think it is a team approach. We all have a role, be it, doctors, family members, therapists, nurses, and then of course the person with dementia, should be an active part in the team and the decision making and communicating, what their wants are. So hopefully you have some good ideas for maybe how to approach certain things in your own situation. So I have my contact information up on the screen, and feel free, again, if you have something that you don't necessarily want to ask right now, but you have something come up later, you can definitely give me a call or email, and I'd be happy to address that with you. But I would like to take a little bit of time to answer some of those questions now, make sure we keep mindful of your all's time this evening. So
Stephanie, that was really good. And you do have a question.
Awesome.
Okay. Can you talk about active dreams? Should the person be awakened of calling out, combative, etc.? What are some ways to handle these times?
Yeah, that I will say I haven't had personal experience with it. I've had some patients who have had that. One gentleman actually wound up outside of his house because he was sleepwalking or, having one of those active dreams. And so I think ultimately it comes down to safety. So again, if the person is safe, I think it would be okay to, leave them be. But if they are in a position where maybe they are, about to fall out of bed, or they're walking around outside, or, they could fall down the stairs, I think, definitely trying to, gently wake them up, reorient them, or gently guide them back to bed. Yeah, safety definitely is just the thing to keep in mind. And again, I know I don't have any personal experience with that. So if that's something that you struggle with, I would contact the Alzheimer's Association, because I bet they would have some pretty specific recommendations for what you could do.
Okay. So I have another question for you.
Yes.
You gave a lot of really, really good tips today. Can these be used across different dementia platforms, or are they more specific towards Alzheimer's?
No, that's a good question. I would say yes, they're tips that hopefully you can implement with any kind of dementia. What I have found is, obviously, with the different kinds of dementia, you might have a different progression. So you might be in a different stage for a different length of time, or you might have more of maybe those aggressive behaviors, or you might have more of the hallucination type behaviors. So I tried to touch on each of those and give you some guidance, but yes, the communication strategies should be hopefully helpful for all types of dementia.
Okay. Let's see. Do we have any more questions for Stephanie? Stephanie, thank you again so much for talking. I learn so much whenever I listen to you talk, and I love it. Thank you so much.
Oh, my pleasure. I hope everyone has a wonderful evening. And again, if you have any questions you don't want to ask out on the forum right now, I'm definitely available and more than happy to answer those.
Perfect. Okay, guys. Well, thank you and have a good night.
Thank you.
Bye.